Good afternoon, everybody. Welcome to the IBHS and Services for Children, Youth, and Young Adults training. We'll be getting started in just a minute. Just to let you know that this training is being recorded, so please keep that in mind. Thank you. So how about others joining? So we'll wait until they all get on. Still got people joining, so we'll get started in just a sec. All right, it is 2:01. Can everybody hear me okay? Yes? Can everybody? Okay, thank you. Just so I know I'm broadcasting okay. All right, good afternoon, everyone. My name is Sue Klaus. I am the manager of the Prevention, Education, and Outreach Department here at Beacon Health Options. Other prevention, education, and outreach staff who are on the phone include Shelly Thomas. She is the coordinator for the Northwest 3 region. We have Karen Steele. Karen is the coordinator for an 8-county area. And then we also have Gigi Green, who is on the line. And she is the coordinator she helps with Greene, Washington, and Fayette. This training is being recorded. So please choose your words carefully. I have, if you notice at the bottom of your page, you have live transcriptions going on to help those who might be deaf or hard of hearing. So we include the closed captions. If you want to turn those off, you can easily do that by going down to the transcription area at the bottom of your page. Shelly, it's a little different when I look at mine. What does yours say at the bottom of your page if somebody wants to shut those off?
It says live transcription, and the acronym is CC. You would just click, it's on the bottom right. You would click on it, and you can hide subtitles or show subtitles.
Okay, so if they're, thank you, Shelly. So if they're bothering you, you feel free to shut them off. Okay, at the end of the training, there will be a survey. It will either pop up at the end of the training if you're on long enough, or if not, you will be emailed the survey within 24 hours. So you can only need to fill it out once. So if you fill it out right after the training, there's no need to fill it out again when it's emailed to you. I will send the PowerPoint and certificates to everybody who is on the training today. Will receive those. Also,
I just want to add that the survey, excuse me, Sue, the survey is included in the thank you. So when you get the thank you it's usually 24 hours, you would click here to complete a survey. And that's how I've experienced it anyhow. So just to make sure you know where it's coming.
Thank you. Also, if you're participating by phone and won't be able to participate in the survey, you can call me at 724-744-6501. Again, that number is 724-744-6501. Leave your complete name with the correct spelling, same thing with your address. And I can get you a Survey Monkey sent to you in a hard copy if you're interested in providing us some feedback and you can't participate via the email. All right, let me go on to the next slide. Okay, we have, again, the raise the hand feature at the bottom of your screen, or you can enter questions in the question and answer or chat feature. Gigi and Karen will be keeping an eye on these, and they will answer your questions if they can. Or if your question is for the host or the panelists, they will bring those questions to the attention of the presenter. Or you can email Gigi. Here's her email address if you'd like to send her a question. Also, you can see at the bottom here, that is the trainings, the previous trainings that have been recorded are located on our website. It's under the member resource section on our website. So you can find those trainings there. All right, we're ready to get started. I would like to introduce our speaker today. Let me stop sharing and she can start sharing her screen. Oh, my transcriptions are in the way. Okay, go ahead, Christine, and
all right,
sure. Explain it. This is Christine Dennis-Liston. Christine is the Associate Manager of the Behavioral Health Clinical Services at Beacon Health Options. She has joined us today to present IBHS and Children and Adolescent Services. So she's done a little bit about this in the past on our trainings from the last series. So she's got some additional information on the change to IBHS or the new service IBHS and other services for children and adolescents. Welcome, Christine.
All right, thank you.
Excuse me for 1 minute. I'm sorry to interrupt, but Sue, did you want me to launch a poll?
Oh, yep. I'm sorry, Shelley. I am so sorry.
Okay.
I completely forgot about that.
I'm just going to go ahead and launch it, but Christine, you can go on. Everybody can just go ahead, Sue.
Okay.
Just if you can complete your question on the poll, and then we'll get Christine started. Thank you, Shelley.
All right, thank you.
I breezed right past the question.
Oh. All right, looks like everybody's filling it out. That's great.
Okay.
I appreciate the opportunity to be able to talk to everybody today a little bit more about IBHS and really all the services that are available to our children and adolescent, because there are a whole lot of different services that are available, and we kind of wanted to, I know we've done a lot of talking about IBHS, and I believe Dr. Eberly did a really nice training last fall that some of you might have attended. I know those trainings are also available on our website if you did miss that one and you wanted more details. But today I kind of wanted to talk about all the different services available and kind of how to get access to those services. So we're talking about IBHS and Children and Adolescent Services. So if you notice that your child is having some problem behaviors and you really want some help addressing those behaviors, there are a lot of different behavioral health services that are available to children, youth, and young adult. But it's hard maybe figuring out, which service, what the services are and which services is right for you. So what is your first step? So the first step is you just need to talk to an expert or a professional, a mental health professional who's familiar with the services, somebody who can kind of assess, what is your need. They will talk to you, they will listen to you as the parents and or caregivers for the child and understand kind of what's going on with that child. They'll ask you a lot of questions about the behaviors. How often are they occurring? Under what conditions are they occurring? And they're really just trying to determine, if indeed the behaviors that you're describing, if they do warrant some mental health services or behavioral health services. And they'll also really be able to determine which is the most appropriate service. So sometimes we hear about different services through, families might hear about them through other families that they know, or, friends, neighbors. They might hear about them through the school as well. But you don't really necessarily know exactly which is the best and most appropriate service for your particular child with their particular behaviors and symptoms. So that's why an expert is needed, a professional, to help you kind of make those determinations. And so we're going to go through all the different, kind of touch base on a lot of the different services that are available, kind of starting with some of what we call like the least restrictive services. We want children to be in their natural environment. We want children not to have dependency on professional services, but to have the least restrictive or least intrusive type of service that is appropriate for their behaviors. So I'll kind of start with, and a great place actually to start when you're asking for help and you're seeking that help. You can start with, I mentioned the different professionals that you might be seeking. It could be talking to your pediatrician. It could also be talking to any other doctor or psychologist that you might be aware about. But a good place to start is also your outpatient mental health clinics. There are a lot of clinics and agencies that are in your communities, and that is always a really excellent place to start. Typically, when you go seeking outpatient mental health treatment, they would have kind of what they call an intake appointment. And in that appointment, you'd be able to speak with a therapist, a licensed therapist, and kind of discover, they do a lot of that assessment of what we were talking about earlier to kind of determine how those behaviors are going and what your problem behaviors are and what the symptoms that you and your child are experiencing. And then they can kind of guide you and direct you. So if it's determined that outpatient therapy would be the way to go, then you can receive that service at a multitude of many different agencies that have those outpatient therapy services. So that's where you would go into an office setting, and you typically would meet with a therapist face to face. They do a lot of different types of therapy, and they will really kind of help sort of individualize it to your specific needs. And often, these kind of services really are the best place to start because they can really gather information and really work with your family without being too intrusive. But if and they also, the nice thing about outpatient therapy is that there isn't any kind of process or something that needs to happen with insurance before you can go in and see that outpatient therapist. Typically, you can get appointments pretty quickly, and then you can just start seeing a therapist right away. So there isn't a lot of process around those type of services, which is one of the things that's very handy. I'm not going to read all the different slides to you. I'm just trying to give you a feel and an idea of what these services are, but we will make these slides available to you after the program today, and then you can have it if you want to read in more detail. But I just wanted to kind of help everybody understand all the different options that might be out there for children. A specific type of outpatient therapy is parent-child interaction therapy. This is a really great program for kids that, particularly kids that are having a lot of kind of acting out behaviors. And you might be struggling maybe with some parenting things. They're not really responding to your discipline strategies. This is an evidence-based practice, which we always really want to promote practices that have been researched. So different types of therapies have had a lot of research around them, and they've been proven to be very effective. And they have a particular style and strategies that are kind of consistent across that therapy. So we really promote evidence-based practice, and PCIT, as we call it, parent-child interaction therapy, is one of those evidence-based practices that have really been researched and shown to be very effective. So this is a really good approach, and it's particularly good for children who are younger, in the younger range, usually typically ages 2 to 7. Again, it does not require any kind of prescription or process around it. You can just look up, many outpatient clinics do have this therapy, but not all of them. But we do have it here at Beacon. We do have directories and things available that we can help you find a clinic that does have the service in your area. But this is a great place to start. It really helps with those younger children who are having a lot of acting out kind of behaviors. Another type of service that is one of, what we're calling kind of less intrusive or less restrictive is case management. Case management is available to children, youth, and young adults. It's what we kind of call community-based. So that means they can kind of go into your home, into the community. They can even go into the school. But their kind of main focus is really to help link you and your family and your child to other different services and resources in the community. So if you're struggling too to kind of figure out, what is available and what is out there in your area, a case management service might be something that would be good for you, particularly if your child has a lot of different needs. They can really help you navigate kind of all the different systems and all those different needs and behaviors that your child and your family might be struggling with.
Christine,
Yes.
we have a question.
Yes.
How do you start with the parent interaction therapy? My son is struggling with behaviors and they talked about it, but none are available.
Okay, so you have checked into it, sounds like, and that there weren't any available at that time in your area, or I'm guessing that's what they're kind of saying. I don't know if they're putting their little notes in the chat, or they're.
It was a Q&A.
Just a question. Okay.
She said BTH are not available.
Okay. I'm wondering too if they're thinking about behavioral health technician, which is part of the IBHS services. And I will be talking about that here in a minute. I wonder if that is what she's referring to. But typically with PCIT, which is done in an office setting.
She says, yes, that's what she's referring to.
Okay. Okay, I will be talking about that in a little bit. I know there is a little bit frustration right now with the IBHS services, as depending on what area you live, there could be, the staff might be low for some of the agencies that have that service. So sometimes it takes a little bit of time to get into the service. So it sounds like that might be the issue that you're having. And if you aren't able to get that service, we would definitely, recommend maybe trying some outpatient therapy or PCIT or some other services maybe while you're waiting. If there's a need and you're having a lot of problem behaviors, those other services could potentially help you. Again, you would, want to seek the advice of a professional to see, which one might be the most appropriate for you. But I know that, there are some issues in areas where a lot of the providers are very short-staffed and they just don't have enough people. I know that, we at Beacon are doing a lot of things alongside the counties to try to help with that situation. So we are working on trying to help providers get more staff so that you can receive those services. I hope that answers at least for now, hopefully. And if you have more questions, please, feel free to type them in, and we'll address them as well. So actually, my very next slide, I think, is IBHS. So what is IBHS? So we were talking a little bit earlier about the outpatient and PCIT and case management, and those kind of services are not as intensive. So oftentimes folks would maybe, or families and children would try outpatient therapy for a while to see if that's helpful, to see if it would work. And if it doesn't work and you really need more intensive services, then they might recommend IBHS, which stands for Intensive Behavioral Health Services. And there's a couple different categories of IBHS. But the main focus of IBHS is their interventions that support children, youth, and young adults that are under the age of 21 that have mental health or behavioral health needs. they can be provided in the home, school, and community setting. Whereas the outpatient services typically happen in office, the intensive behavioral health services can happen in the child's natural setting, like home, school, or other community setting.
Christine,
IBHS,
there's a question. Sure. If you can continue in describing how to access PCIT, it is a simple process compared to IBHS.
Yes. Okay. Yes, absolutely. Yeah, with PCIT, again, here at Beacon, we have a 24-hour, 7 days a week of phone lines, toll-free phone lines that are available for members. And you can call us and we can locate a provider that is, in your area, giving us your address, and we can figure out those, which providers are available. And then you would just need to call the provider and set up an appointment for, PCIT or for them to sort of assess and see if that's the right service for you. But we do have a lot of providers, all around. For Beacon, we kind of have 12 different counties that we kind of help support. And there are many outpatient providers that do have the PCIT program. Yeah, that's a great question. So getting back to IBHS, there's sort of three different sort of categories of IBHS services. One is individual services. The other is applied behavioral analysis services, or ABA for short, because that's a mouthful, and group services. And underneath that, like the individual services are therapeutic interventions. They're really looking to help your child by developing an individual treatment plan. They will work with you on goals and supporting, coping strategies and social skills, and just developing positive behaviors. There are a couple different services within the individual service category. There's behavior consultation, mobile therapy, and then the BHT, behavioral health technician. And we do use a lot of acronyms, a little initials for all these different services. So I'll try to say the whole name, but sometimes we abbreviate a lot. And these services we typically do. Behavioral consultation, we say BC. Mobile therapy, we say MT. And behavioral health technician, we say BHT. So I think sometimes those letters can get a little confusing. So I want to be sure that I'm, giving you all that correct information. So, and then under the applied behavioral analysis services, again, this is an evidence-based service. So again, it's been researched and proven to be effective. It is particularly effective for children who are on the autism spectrum. But it also can be helpful to other, kids with other diagnoses as well. Under that sort of category, there are several services available. There's behavior analytics services. There is behavior consultation for ABA. There's assistant behavioral consultation, and then also the behavioral health technician, ABA. And then there's also, oh yes.
There's another question.
Okay.
Does accessing case management services also as simple as a phone call to Beacon, no evaluation or script letter needed?
I believe there would need to be a diagnosis. So it could be something from your doctor that would show the diagnosis to kind of get you started. But yes, if you call Beacon, we can also help you select a provider that has those services available, give you all the address and the name and number of the closest one in your area. And then you could just call that provider and they would help instruct you for the exact thing that's needed. But typically, I believe they would need just some evidence of a mental health diagnosis. But then I think I was just beginning to talk about the group services, which is another category of IBHS. And in the group services, a lot of those, are really helpful because the function of that service is really to be provided in the group environment. So the child is surrounded by his or her peers, and a lot of learning around social skills can happen in that way. They can also be provided in school. We have some school-based behavioral health programs. And I will get into a little bit more detail about some of the specific group services that we have in a few minutes here. But I just want to kind of give you an overview of IBHS and kind of the different categories of services there. And again, a professional will see you for face-to-face and kind of assess what, if any, services that you need and which one is the most appropriate. And they will definitely, discuss those with you. IBHS services are children, again, they do go from 0 to 20. And it's really helping develop appropriate behavior, activity skills, social skills through your natural settings. They also provide opportunity for family independence from professional treatment. So because, they're intensive services, they're not meant to last a very long time. They're meant to be a shorter duration because they are so intense. They can be provided for, again, the home, school, and community, but also for certain number of hours per month, and that could vary, again, depending on the behaviors and the symptoms. But they are meant to kind of really get in there, work with the family, teach your family, teach the child different skills and strategies to work with those behaviors and improve those behaviors. And then, to kind of, get out. We kind of say you work on discharge from the very first day, because the goal is for a discharge or a graduation, and not for, needing the services for a long term.
Christine, we have another comment.
Sure, yeah.
Says in Crawford County, in order to access BCM or case management services, there needs to be a recommendation from the doctor, psychologist, or psychiatrist, and there does need to be a mental health diagnosis for the child. BCM services can also be offered to adults as well, but follows the same process.
Thank you. That's great clarification. Thank you so much. All right. And yeah, and some, that was a great point. Some counties might have slightly different processes on some of these things as well. So that's a really good point, which reminded me too, that your county Department of Human Services, and every county has one, they're also very much available to families to help support them in finding the right service, finding people to work with them, and kind of explaining what some of the services are as well. They are a really good partner for your families, and they're available to everyone. So that was really a great comment. Thank you so much. But again, the services are kind of focused around, a set of goals. And again, that's determined by the family. What behaviors do you want to work on? What are the most urgent? And the clinician that you're working with that comes into the home, school, or community will really help you refine what those goals are. And then they'll develop what we call sort of interventions, which is just sort of tips and strategies and hints and ideas on how to help manage those behaviors that are problematic. So I will move on. I'm going to pay attention to time and make sure I'm kind of moving through things. So what we kind of call site-based autism programs are part of those group services. We also sometimes call them social skills groups, but there are a lot of different group services available under that IBHS umbrella, and the site-based autism or social skills group is one of them. They may, again, not be available in every single county, but they are available in a lot of counties. And they really help work on the social connectedness, communication, social skills, self-regulation, and their function is to work in that group setting amongst their peers so that the child can practice learning all those skills and practice in the natural environment with their peers. So this is a really great group service program, and they're pretty available. And again, the same way to access them as all IBHS services you would need what we call a written order. So you would need to see that professional who would make the determination if the services are needed and which is the most appropriate service. And then they would write what's called a written order. So they write that order up, recommending the particular IBHS service that might be needed, or if another service is needed, they would make that recommendation for anything any of the services that we're going to be talking about. So that is just a little hint here about, just an idea of some of the group services we have. Another one of the group services that we have in a few counties, now not all counties have this, but a few do, is the school-based behavioral health. So sometimes if the child is, having particular problems in the school and they need some more support in the school, these programs are in 4 of our different counties, and they have staff that are in the school and they work with the child in a group setting. And also if they're struggling in the classroom, they can pull the child out and work with them, outside of the group setting as well. So there's a lot of opportunity there. We also do have school-based outpatient services. So similar to what we were speaking of earlier with the outpatient, in which you would go to the office to meet with a therapist, they do have therapists that are embedded in different school districts, and the child can actually do a therapy appointment in the school during their school time. So many different counties and school districts do have that service available as well. So whether they're struggling with school issues or just other issues that they need to address, that could be an option, your school-based outpatient services. And then as well as, which is slightly different than the school-based behavioral health, which is part of IBHS. Then we have Summer Therapeutic Activities Program that is available in the summer. And again, it's a group service under IBHS. And it, again, focuses on a lot of coping strategies and social skills. There's recreational and therapeutic activities as well. And that typically happens for a certain number of weeks, 6 to 8 weeks in the summertime.
We have another question.
Sure.
Would that be double dipping for insurance companies?
I guess what specifically?
That I don't know.
I know. Okay, maybe because when I was talking about the school-based things, is that what they're maybe asking?
Possibly.
Okay.
Yeah, services in school. Yep.
Yeah. Okay. Good. Thank you. Yeah, you would have one or the other. So if you had the IBHS intensive services and you had that school-based behavioral health program, that is a whole program in itself, and it is intensive service. So you would not have that at the same time that you could potentially have the school-based outpatient services. They are 2 different sets of services. And again, with the outpatient services, that's sort of a lesser restrictive, less intrusive type of service. It's not as intensive. That's a great question. And then we can, I see a little yellow flash. Is that when more questions are being asked, or should I stop there? Is somebody else asking?
No, she was just saying thank you.
Okay, good. Thank you. I'm glad you guys are monitoring, because it's hard to talk and then try to read those questions. So I appreciate that. So another service that's available to children, adolescents, or children, youth, and young adult is family-based mental health services. And these services incorporate, working with the whole family. And oftentimes these services, if maybe other services, less restrictive in services like IBHS or outpatient therapy have been tried and they just haven't been successful, and maybe there are some, dynamics in the family, or maybe there's multiple children having some issues and behaviors.
We
Family-based
do have another
services.
question, Christine.
Sure.
Are there STAP programs this summer given COVID? Is there a contact email or phone number to get more information?
Yes, and again, I don't know if you guys had, like, we could put it on like the Beacon member numbers, but yes, certainly we don't have very many STAP programs, so that they're only in a couple different communities, I believe, and so it's not readily available, just depending on where you live, if that one is available. But you can call into our member number, and we can get that information about where you live and if there is a program in your area. Okay. So the one part about family-based mental health services, it is more intensive than even the IBHS services. So oftentimes, if kids are really having severe behaviors and maybe they are in, some crisis situations, or maybe they're kind of at risk of maybe being placed outside of the home, family-based mental health services might be an option that is available, because it does actually come with a crisis component where somebody is available 24/7 to assist and support the family with any type of crisis stabilization. But it really looks at, working with the child individually, and then also working with the family. They can work with sibling issues, parenting issues, and they usually kind of, try to address all of that. And it is an intensive service, and it is typically delivered by a team of 2 different clinicians that can help support the family. They also can address, if there are behaviors and things in the school, and can help be an advocate and support, behaviors in the home, school, and community. Let's see. Again, this is just giving a few more details about the different types of interventions that can be included in family-based, the different family sessions. There's ongoing collaboration and support. Again, we will have these out for you to read in detail. I just want to I know we're kind of running on time, but I just want to be sure I have time to answer questions and kind of just give you a short little synopsis of each one of these services. And then you will have these slides if you want to read more. Another type of service, which actually does fall under the IBHS services, it is intensive service, and it is also an evidence-based service, which again is that, service that's been researched, is multisystemic therapy, or MST. It is intensive family and community-based treatment. It is a home-based model of service, but they're really looking at children, youth, or young adults that may have more chronic or aggressive or violent behaviors. Oftentimes this is appropriate if children in the families involved with a CYS, or if they've maybe had some issues and they might be involved with juvenile probation agencies. So if a child has a lot of different systems, like those systems working, that are struggling in a lot of those different system areas, particularly also the education system, if they maybe are having some truancy issues or some real severe struggles in the education system, and things are not, working. They've tried other different services in it and things aren't improving. MST might be the most appropriate
Christine, we have another question.
Sure.
Often FBS teams can be helpful with the whole family, but is it possible if a child has IBHS/ABA or individual and they are unable to get staffed with RBT or BHT, can they also maintain BC services with possible FBS services?
Yeah, the family-based services. Yeah. I mean, typically those services would happen, kind of one at a time, but there are certainly cases, that could be an issue, and they might need both services, or part of one service and the family-based service at the same time. Again, the mental health professional that sort of is assessing the child's need for services would be able to determine, if both of those services were needed to happen at the same time. Or again, I think like the question was sort of asking if maybe the other service isn't available in your area, or maybe you're waiting for the IBHS service. And if family-based is appropriate, that might be a way to go to help support the child and the family. Absolutely. Okay, so MST. There's also a service called partial hospitalization program. And again, this is a more intensive service. It is not under the IBHS umbrella, but is a service where, typically sometimes if children are having really severe behaviors and they may need to go into the hospital, and then when they're coming out of the hospital, they might go to a partial hospitalization program. So this is a service where part of their day is spent in this program. They do have education within this program, as well as, group therapy, individual therapy happens in this program. And they also have psychiatrists available to evaluate medications. So if there's a need for a lot of medication changes, or things that really need to be observed on a more, a longer time period, and throughout the day, that partial hospitalization might be a good program for a child in that kind of situation. So that is available as well. Community residential rehabilitation, or CRR. Again, this is a higher level care, so much more intense service. This is a service where, again, if there's severity, like a lot of severe behaviors going on, and maybe they've tried some of the other services and have not been successful. But this is where the child is actually, placed outside of the home into a foster home, but the foster home they've had a lot of education and training on managing behaviors. So the foster parents really help work with the child, but in addition to that, they typically would have two other professionals, therapists, kind of working with the family of origin, and then also the foster family working with the child's behaviors. Often, again, there is a crisis component, so they, can be available. Those therapists or clinicians can be available 24/7. Oftentimes, they can also do some trauma therapy if that's needed. And the idea here is really to stabilize those behaviors. Taking the child outside of the home and putting them in a different setting can sometimes help to stabilize the behaviors. They're going to learn a lot of new skills. And then the idea, again, of course, is to, reunification with the family, if that's possible. So that is another service that is available for children. Here. And then residential treatment facility, which is, we call it RTF. Again, we have a lot of initial abbreviations that we use. And these residents, again, are placed outside of the home into a different setting. Could be home, could be, there are different settings that are available in RTF. And they're getting a lot of supervision. They have 24-hour supervision there. They have a lot of therapeutic interventions and specialized programmings that are available. Again, this is the behaviors would be pretty severe at this point, and it really helps to stabilize the child and the behaviors. They can also do medication management treatment in the RTF as well. They do have, again, sometimes nursing services. They have individual and group therapies. So they're teaching a lot of skills to help the child stabilize. so that they and get the behaviors kind of under control so that they can go back to their natural environment. Oftentimes, the children that do go in, need this residential treatment facility services are having a lot of risky behaviors, either risk of harming themselves or harming others. And we really want to keep them safe. So that service is available. And then, of course, one of the highest levels of care is inpatient psychiatric hospitalization, which is where they would enter a psychiatric hospital for a time period. Again, this is a very, high level care, and there would be, if there's some safety issues around, harm to self or harm to others. And again, it's like really to stabilize. A member would not want to keep them in that setting for very long, but they do have, group treatment, individual treatment, family treatment. They do have, obviously doctor and nurses care while they're in the hospital as well.
Christine, there's a question. Can you inquire about youth and young adult care when there's, thank you.
I'm sorry, I missed it. It was the youth and young adult care for what?
Can you inquire about youth and young adult care when there is a peer?
When there is a peer?
Yeah, I'm not sure.
I'm sorry. Yeah, and maybe whoever wrote that, if you can kind of clarify a little bit, that might help us. Sorry about that.
YYA CPS.
I think it's youth and young adults certified peer specialists. Is that what she's asking?
Oh, peer support. Okay. I'm sorry
Okay.
if I missed that. Yes, actually I should have had a slide here for peer support. Yeah, I'm sorry about that. That is actually a really wonderful program that in the last few years has opened up to children. I believe they have to be 14 and over. It did used to be just on the adult side, and maybe 3 or 4 years now, they did open up for the young adult, the adolescent young adult age group. That is where a peer support specialist is a person the same age range as the child that might need that service. And they have been trained. They've had some specific training to kind of work how to work with kids, how to talk with kids. So it's somebody in their same age range, and it can be really helpful, particularly for kids who are struggling and they really maybe don't want to listen to other adults, and having somebody their same age. And the peer support specialist also does struggle with a mental health disorder. So they can kind of share their struggle in their, in their life and share that with each other. And so they really can have a nice, bond and sharing. And sometimes it's easier, particularly like for teenagers, to talk to another teenager maybe than, to talk to a therapist. And it's a good way to provide that support, that camaraderie, that, that's been a really wonderful service. And yes, I will have to add something, add a slide about that. That's a really great question. Sorry, I missed what that was in the beginning, but that's a really, really great service as well. And again, I'm not sure if all the counties do have that. I believe so. But again, calling in to our Beacon number or calling into the county human services office, they could help get that set up for you as well. But peer support services is definitely a great service for children as well. And then here I just have, again, we do have substance use disorder services for children. If that is their area of concern, we do have that available as well. There's detoxification. There's, again, we'll list all the different things. I know we're kind of running out of time, and I want to leave some time for questions, but the substance use disorder services are available to children as well. And then I think the last one here is just a little bit more about psychological and neuropsychological testing. So sometimes when you're not exactly sure, you just know that maybe your child is struggling with some behaviors, having some symptoms, but you really are not sure, what it is. And maybe you have talked to your pediatrician or you have talked to a mental health, therapist, and really just need some clarity on maybe the diagnosis or the symptomology of, kind of what's going on. You might need a more thorough test. So you could have a psychological evaluation, you could have a neuropsych testing. There's different tests that they can do, and really meeting with a psychologist or a neuropsychologist would really help you kind of determine what are the best tests that they'll do to help establish kind of what what diagnosis is the most appropriate and maybe what services would best fit with what they're seeing through all the testing that they're doing. So those type of tests are available as well. So really that is the end of my slide. I wanted to make sure we had time for more questions, and just also let everybody know that, there is a lot of options out there. I think sometimes in the past, we had the service, some of you may be familiar with BHRS, and we've kind of had a new changeover in that service, and we're really have changed things, and it's a brand new service to have the IBHS. But I wanted other folks, to be aware of all the different services that may be available. Sometimes we just hear about BHRS in the past, and now IBHS, we hear about it most maybe. But I just wanted folks to know that, there's a lot of different services available for children. And really it is best to have that mental health professional or your pediatrician, or talking to, going to an outpatient clinic for an intake appointment, and having the expert professional help you determine, which is the best service. They can do a lot more education on how those services work and what all is involved in the service. And also just wanted to let everybody know that, again, Beacon and your county human services offices are very available to you for any type of referral. If you just have questions about the services, if you are, struggling with some behaviors and you really just don't know where to start, just to start by picking up the phone and calling Beacon or calling the county is a great place to start. We have a lot of folks that are on the other end of the phone that really want to help support you and have a lot of knowledge about what is available in your particular community. So I just wanted to kind of throw those out there and give you little snippets of those different services that are available, and let you know that, help and support is available, and we're just a phone call away.
Christine,
But
there's another question.
Absolutely.
I have 2 children under 5 years old on MA, 1 child with autism who has ABA services through Beacon, and 1 who is pre-verbal and has a number of behavioral issues associated with sensory seeking and not being able to adequately communicate.
Yeah.
I'm trying to figure out how to get the second child behavioral health services. Any recommendations, since there may not be a behavioral diagnosis? We have considered PCIT, but sibling to sibling interaction is also an area of concern.
Okay. Yeah, I mean, that's a great question. And I think, I don't know if you have taken the second one. It sounds like the first one is kind of set up with some services, but the second one that you were mentioning, have you, been to an outpatient clinic at all for an appointment, or have you gone to see a psychologist for like an eval or some testing, or have you even just talking to your pediatrician about some of those behaviors? Have they made any recommendations at this point yet? Because those places are always like the great places to start. I mean, that's what I would kind of recommend. And particularly if you didn't have a behavioral health diagnosis, but you do have these behaviors of concern. And I think you mentioned pre-verbal. I know, also there's a lot of early childhood intervention services and speech therapy, occupational, OT-PT type of therapies that are available for the younger children as well. That is always sort of a good place to start. But if you're concerned about the behaviors, outpatient clinics or seeking a psychological evaluation, we do have also the IBHS agencies that do the service, and maybe even, I'm not sure which one you're involved with your other child, but they might have a psychologist on their staff or a licensed therapist that could assess the child for the need for services. So, you can talk to your current provider that's working with your other child, and they might be able to assist you as well. Are there any other questions? I know we just have a few more minutes left, but if anybody has any other questions, I'm happy to take them now, or I do have.
Christine.
Yes.
This is Shelley. Somebody in the chat had mentioned about getting a list of people who provide IBHS services
Yes.
in their county. And I put in the chat, just to let everybody know, and I did put in the chat where you can, it's on the Beacon website where you can access that list and click on it. And it's an excellent resource and has all the counties and all the providers listed for each of the counties. So I wanted to make sure everyone knew that that was available for, just getting on the PA Beacon website. I do have the link in the chat.
Oh, thank you, Shelley. That's so helpful. Yeah, I was gonna remember to mention that as well. If you haven't been to our Beacon website, there's a lot of really great information there for members. And we do have the provider directory specific to IBHS, and it lists out which providers are available in which counties and what services they do. But we also have a whole web page that's right there, kind of in the top, that you can click on for IBHS if you want more information. There's some family information on there, as well as provider information. But there's some trainings and previous trainings and recordings that might be helpful as well to understand a little bit more if you want to understand more about IBHS. Our website is very helpful.
And the acronym list, which we all find.
Yeah, I know. There's
Very
so many
helpful.
letters.
Yeah. So that's, and the facts about, it was like, there's links to facts, facts about IBHS. So it's very helpful, I think, for families, and put in a language that's easy to read and understand. I think there's an FAQ
Yes.
also referenced on our website. So there's a lot of information available on the Pennsylvania pa.beaconhealthoptions.com, and then you click and there's many different options. You can go to members, you can go to IBHS. There's a lot of clicks, a lot of resources there.
Absolutely.
Christine, can you unshare for just a minute?
Oh yes, I'm sorry.
That's okay. That's all right. I'm still, if there's any other questions, please answer them. You have any others?
We don't have any others.
Okay.
And the one thing too,
There was something about CEUs.
Yeah,
We
it
don't
was
have-
answered.
Yeah. Unfortunately, we don't have CEUs for member trainings. I can send just a attendance certificate.
Yeah, I know that the member newsletter that goes out once a year will have some information about IBHS in there as well.
Okay, I am trying to get my PowerPoint's not coming up. I apologize. Oh, here it is. Okay. All right, so we didn't have any more questions, correct? Can you see?
No,
Can
no
you see
question.
the screen?
Looks like we did right good with our timing here, just right on time.
Okay, I am just going to review. Thank you very much, Christine. As always, tons of great information for everybody. And I appreciate you doing this for our families, and they really can use all the information they can get so they can access the resources. And they can always call Beacon for help. So
Absolutely.
never
Yeah.
hesitate to call us.
Great. And I will get this PowerPoint to Sue, and Sue will send it out to everybody, I believe.
Thank you.
All right. Thanks so much.
And our next training is on Friday, April 23rd from 1 to 2:15. That will be our uncomfortable conversations about stigma, race, and bias. We're going to do some more conversations around microaggressions. And the panel of all the names below will be there to discuss. So please join us. It's always a great conversation. And I hope you can be there on Friday. You can visit the Beacon PA website at pa.beaconhealthoptions.com, and you can register for the training. It's on the member page, right on the front page. If you scroll down, when you go to that website, you'll see the member training schedule, and you can schedule right from there. Okay. With that being said, I think that's everything for today. If there's no other questions, we can let everybody go for the day. Were there any other questions, Gigi? I guess not. All right, everybody. Thank you. Have a great afternoon. Bye-bye.